Welcome to SMA's Women's and Children's Health Podcast, a publication of the Southern Medical Association. This podcast explores all aspects of care of the female patient across her lifespan. It will also explore the special and unique care of children and adolescents. Welcome to the Southern Medical Association's Women's and Children's Health Podcast. I'm Lee Boughton. Today, we are pleased to have Dr. Jennifer Wells on the line. Dr. Wells is based in Roanoke, Virginia. She is associated with the Carilion Clinic's Department of Psychiatry, where she is actively involved in creating a women's health center specializing in treating psychiatric illnesses in pregnancy, as well as managing substance use disorders in pregnancy. Dr. Wells is also one of the speakers at SMA's 2019 Focus on Women's Health Conference in Kiowa, South Carolina. Welcome, Dr. Wells.
Thank you so much. Glad to be here.
Thank you for joining us. Today, we are going to discuss substance use disorders in women. How has the opioid crisis affected women in general?
I think everyone is aware now that we're experiencing a massive opiate crisis in the United States. And from a historical perspective, this is maybe the third or fourth such epidemics of its kind in our nation's history. But this one is similar to some of our past epidemics in that it includes or features a large proportion of women. And it was also driven initially by physician prescribing practices. This epidemic, however, is on a much greater magnitude than we've ever seen in the past. And part of what I want to accomplish in this talk is to put forth a lot of different reasons why women are overrepresented in this current crisis. There are sex and gender-based differences in pain in women, as well as in substance use disorder in general in women. We also have gender-based prescribing biases towards women, and we generally tend to not think of women as people who use drugs or who develop addictions in the same way we think of those same behaviors for men. I think there's also cultural differences that contribute to this problem. So as a result, compared with men, we're much less likely as physicians, clinicians dealing with people, women in the substance use disorder, we're much less likely to screen, assess, and refer these women for treatment of misuse and or addiction. And all of that adds up to creating a crisis where women are increasingly at risk.
Why is it important for women's health providers to be educated about substance use disorders?
Well, as I just mentioned, it's an increasing crisis that women are affected. We imagine that about 1 in 10 individuals are affected by a substance use disorder of some kind in the United States. So that's a massive number, even when you separate out for men and women. It affects every part of a woman's life, from her physical well-being to her hormonal well-being, her mental well-being. And so it becomes critical that doctors learn to screen, assess, and refer to treatment anyone who's suffering from the condition. I think when they look at the numbers of people who get treatment for a substance use disorder, we see only about 11% of people with substance use disorders report receipt of treatment. And when we look at other chronic conditions like diabetes or depression, the number is more around 70% of people with depression, hypertension, or diabetes receiving care. So obviously the medical establishment has a long way to go in making sure that those suffering get the treatment they need.
What are the concerns about opioid addiction in pregnant women specifically?
Addiction is a chronic condition, just like diabetes, depression, hypertension. And so what we want to do with addiction is the same as what we want to do with those other chronic conditions, and that's to maximize the treatment of the disease. And in pregnancy, that means optimizing maternal and newborn health as applies to addiction. Ideally, we want women with chronic diseases to have stable disease at the time of conception and through pregnancy, because we know that this maximizes the birth outcome. So just as I said before, we've identified that there's a massive treatment gap in the United States for women especially pregnant women with substance use disorders. We think roughly about 25% at best of pregnant women with an opiate addiction are receiving any care. So that's 75% we're still missing. And what we know is untreated addiction in pregnancy is a serious medical condition. It's associated with preterm delivery, low birth weight infants. It's also associated with the acquisition and transmission of HIV and Hep C. It's associated with overdose and overdose death. And when we look at the flip side of that, women who are treated during pregnancy for their opiate addictions, their deliveries are associated with normal weight infants at term. And we know that pharmacotherapies used for opiate use disorder stabilize the intrauterine environment and allow the babies to grow more healthfully. They also help to structure and stabilize the mom's social circumstance so that they can have happier, more well-functioning lives. So it becomes critical to identify these women and get them to treatment so that we can have a healthy mom and a healthy baby.
Thank you for joining us again today, Dr. Wells.
Thank you.
Thank you for joining us for this Women's and Children's Health podcast. To listen to more podcasts on this and other topics, visit sma.org/podcasts.